Hey guys, we are in Marble Falls, Texas right now, and we've driven all the way from Southern California to Marble Falls, Texas with 6-month-old twins to go see our biological dentist. And a lot of people might think we're crazy, but when you start understanding really what biological dentistry is and how your oral pathology plays a role in your systemic overall health, you start understanding that biological dentistry is one of the first places to start if you want to improve your health. So that's why we drove all the way halfway across the country to see Dr. Stuart Nunnally, the best biological dentist in the world, bar none. He's been on our show multiple times. So we're going to take a little tour of his brand new facility in Marble Falls, Texas. And that way he can show you a little bit around his office, what he does, and why it's so important. So check this out.
So what you see here is, of course, Kate's having her teeth cleaned, and by one of our wonderful hygienists, Tabby, who's been here for 25 years. And one of the first things that we do when a patient comes to have their teeth cleaned is we take a sample of bacteria from underneath the gum line.
Okay.
And we put that under a microscopic slide, and then we take that to our microscope and look at it, because there are certain periodontal pathogens, certain bacteria in particular, that can cause a systemic health effect.
Okay.
We're trying to eliminate the possibility of these bacteria because the microbiome of the mouth is a very interesting microbiome, probably 1,000 different species of bacteria. Yes.
Wow.
Yes. And most of them are not that big of an issue, quite frankly. But some of them are.
So what do you do when you find something? I guess that depends what you find.
Yes.
Under the microscope.
Yeah, so why don't we go look at Kate's slide. So on this particular slide, we see a number of bacteria. This one in particular that has sort of a corkscrew-looking appearance to it is called a spirochete. And we're not very fond of spirochetes because spirochetes, although they love gum tissue, they also like heart tissue and they like brain tissue. They like the tissues, especially the arteries that supply the heart with blood and the brain with blood. So you're much more prone, quite frankly, to heart attack and stroke when we see those bacteria.
So does everybody have spirochetes?
No. No, the beautiful thing about it is we can help eliminate, we can actually eliminate them, the patients can. Mm-hmm. The patients can do a lot to eliminate them by using a water pick and by putting some hydrogen peroxide in the water pick solution. So why don't we, let's show you what we recommend in terms of the solution. So this is a little prescription for how to make your own solution in the water pick. Sometimes we'll recommend that people use organic apple cider vinegar to water.
Okay.
But I like this hydrogen peroxide to water at a ratio of 1 ounce to 8 ounces in the water bath.
Okay.
And the patient simply irrigates with that, trying to jet the solution of hydrogen peroxide in water under the gum line. Okay. And spirochetes are anaerobic. They don't like the oxygen from the hydrogen peroxide.
Is that okay to mix the hydrogen peroxide with the ACV? Or you do one or the other?
No, I'd do one or the other.
Oh, really?
Or you could alternate them.
Okay.
But hydrogen peroxide has a significant impact on spirochetes.
Interesting.
Sometimes people will ask, because there are many species of spirochetes.
Okay.
Sometimes people will ask, are these the same spirochetes that cause Lyme?
That's where you hear that word a lot.
Yeah, you hear it, but actually these are not.
Okay.
But they're still pathogenic. We don't want them.
And what do they do? They're in the mouth, and do they travel, you said, throughout the body from the mouth?
They do, positively. And you find them in the endothelial lining, that is the lining within the vessels of the heart.
Interesting.
And you also find them in the lining of the vessels of the brain. So you're much more prone to heart attack and to stroke when we see these bacteria. We don't like them. The good news is you can kill them, and oxygen kills them. So that's why we like the hydrogen peroxide in the water.
And so that would be after each time you eat or multiple times per day, would you do that?
I would just use that water pick twice a day.
Okay.
Do it diligently for at least for a couple of weeks. And then if you can find a dentist who uses ozone, as we're going to do here,
that's key.
You take the ozone and you literally run, we have it comes out of an ozone machine.
Okay.
And it literally flushes this pocket between the gum and tooth with ozone, and that kills them dead on the spot.
Isn't that interesting?
Yeah, but they burrow deep enough in the tissue and so forth that they come back. You have to stay after them yourself at home.
It's ongoing.
Yeah, but you can keep them at bay. You can literally eliminate the spirochetes with good proper oral hygiene.
Now, do we know if they're originating in the mouth and then migrating to the other areas, or vice versa?
Well, but that's an interesting question. One of the things we know for sure is they're certainly contagious. You can transmit them to your partner.
Okay.
You can transmit them and receive them from your pets. A lot of people kiss their pets.
Yes.
Well, those same spirochetes show up in their mouths.
Interesting.
Yeah, so it's best not to kiss your pets.
Wow.
What we're looking at here is a commercial ozone generator. This is a company that's very well known for making ozone generators, named Longevity.
Okay.
They're based in Canada. And you can walk into Walmart and buy an ozone generator.
We have one, yeah.
You can buy them for your home.
Uh-huh.
And those ozone generators take the ambient air and they cycle them through. And they do create ozone, there's no question about it.
Okay.
And they do help purify the air because ozone is one of the most negatively charged molecules on the planet.
Okay.
And as it turns out, most of the molecules that we associate with illness are positively charged.
Okay.
So even down to dust particles and environmental toxins,
Okay.
they're positively charged. So ozone is what God put in the world and the atmosphere to neutralize those.
Okay.
And to give us a fighting chance.
Give us some sort of resource to have a...
Because if we didn't have ozone, in the atmosphere, we wouldn't be here.
Yeah.
It's wonderful. And the reason ozone gets a bad rap is because when we hear of an ozone action day, you can measure ozone, but you can't measure all of the environmental toxins.
I see.
So ozone's pretty easy to measure.
Right.
And so when we know ozone is elevated, we know the environmental toxins are elevated.
Okay.
There are two issues with ozone. There are two of our tissues that don't tolerate ozone well. One is the surface of the eye.
Okay.
And that's why on a day with high toxicity, not only the toxins will bother you, but the ozone can actually bother you.
Just from the ambient atmosphere.
That's right.
Okay.
And then the other tissue is the surface of the lung.
The lungs, yeah.
So we might, on a real high ozone action day, we might feel like we've got a little bit of a cough.
Okay, right.
So, but when ozone is made like from a machine like this, most of the ozone in the atmosphere comes from oxygen hitting the ultraviolet rays of the sun, and that can energize O2 into O3.
Okay.
90% of it comes that way. 10% of it comes from lightning strikes.
Yes, I've heard that.
So a commercial ozone generator literally has a lightning bolt going through it, taking medical grade oxygen and converting that into ozone.
So you have the medical grade oxygen.
You would only want to inject or use in a biological way. You would only want to use medical grade oxygen.
Okay. For home use, you can do the commercial grade. Is that what it's called?
If you're going to use something home use or clean vegetables or something like that with ozonated water,
that's one
thing.
Okay.
But we would never consider injecting ozone or even insufflating with ozone around someone's gum tissue without making sure that it comes from
the medical grade.
O2. Absolutely.
Okay. Yeah.
There's just too much of a risk.
Yeah. Isn't one of them 99.999? The other one's 99.97.
I think
purity,
you're probably
something
right.
like that. Yeah.
You're probably right, but we
You have to be.
we're not going to run that risk.
Yeah, not at a practice like this. Yeah.
No. By the way, while we're talking about water picks, we like to have patients use this little water pick tip. And by the way, they're typically, I think these come most often with water picks, but sometimes the water picks patients buy don't have this little flexible rubber tip.
Okay, right.
That's the money right there.
This
That's what
little
you
guy.
want. That's what you want, that little flexible tip.
Okay.
Because it's small enough that you can really inject the solution under the gum line. You're flushing them out.
Okay.
You're flushing the bacteria out.
Okay. And that's those spirochetes we looked at.
Yes. If you don't have that tip, you're going to have something that's more blunted.
More like this.
More
yeah.
like this. And that's not nearly as effective.
Because you can't get it really under the gums,
No,
can
you cannot. It's just it doesn't
Too
shoot
big.
a fine enough string.
Okay. So what brand is this? Is this the brand people can buy?
I think it's just regular water pick. It's water pick right there.
Okay.
Yeah.
Okay. And you can, so the key is looking for that tip.
Yeah. And that's
Okay.
just anybody can get this at Walgreens or Walmart or it's not
Okay.
like it's
That special or that.
no.
Okay.
The tip's the key.
Wow. So you could do ozone and the apple cider vinegar solution that we just talked about in there, and maybe every other day you could switch.
To switch them keeps. So the question is, can you switch these irrigation solutions? Like you could use apple cider vinegar. You could use hydrogen peroxide.
Okay.
We also like colloidal silver.
Okay.
Colloidal silver. So you can switch those around.
Okay.
And it kind of keeps the bacteria a little bit more.
Kind of more guessing, right?
Keeps them guessing.
So you could do one day, you could do one of those solutions 3 or 4 times in that day, and then another day you could switch to silver, do that 3 or 4 times a day, and then switch up like that.
Right.
Okay.
That's especially if you have seen a dentist and you have a real active slide where we know the microbiome of the oral cavity is out of balance, then it's a good idea to do that. One thing we don't want to do is we don't want to nuke the microbiome.
Not too much.
We don't want to nuke the gut microbiome. We don't want to nuke the oral cavity microbiome because those bacteria are friends.
Yeah.
Also.
Yeah.
They're wonderful friends. And so to think, and that's one of the problems in my opinion with using commercial mouth rinses that have a lot of alcohol in them. They are effective at eliminating bacteria, but interestingly enough, those bacteria are important to you. So you want to keep some bacteria.
So this will kill the spirochetes and other bacteria, but not too much.
Now, the beauty of it is it goes after the anaerobic bacteria.
Okay.
The anaerobes are typically the ones that are the problem makers.
Okay.
So what we're looking at here is a cone beam type of radiograph.
Okay.
Really a tomogram, or most people would describe it as a CAT scan that's just really related to dentistry and ENT type folks.
Okay.
The beauty of this kind of machine is it allows us to see the teeth and the jaws in the 3 dimensions.
Oh,
So
okay.
a 2-dimensional flat screen X-ray is very helpful, but this is really the gold standard.
So by getting a 3rd dimension on it, you're able to see bacteria, maybe decay or things that a 2-dimensional machine wouldn't show you at all?
You won't see bacteria, but you will see, for example, in a 2-dimensional X-ray, if you have let's say you have an abscess on a tooth,
Okay.
and it's back behind the root,
Okay.
and you take a X-ray of that, you never see the
You're never going to
abscess.
see it, yeah.
But if you can flip the tooth and look at it from the back side, which this allows us to do, then we can see all dimensions of the tooth.
Now, most dental offices don't have something like this.
Not most. This is expensive, very expensive. But more and more dental offices do have them.
Okay.
especially offices where maybe they're doing implant dentistry.
Okay. Yeah,
'Cause these
that
are
would make
all-
sense.
I think these are pretty much a must for implant dentists.
Okay. Yeah.
And so I think it's worth knowing a little bit about what cone beam technology offers us over traditional X-rays.
And it's and this is something that you do with all patients or just certain patients?
We do it with most because most of our patients have been referred to us because they're ill and their physician or referring healthcare provider wants us to inspect the mouth closely to see whether they have pathology that you can't see on a standard X-ray.
Okay.
So probably many people have heard why we do what we do at our office, but the main reason is because I got sick myself. I thought I was bulletproof, and I was about 48 years old and
Felt great.
felt great. Pretty competitive triathlete, and 3 kids, awesome wife, and just things were rocking along beautifully. And then I began to have some neuromuscular issues, primarily on my left side. And it just progressed and progressed to the point of...
What were your symptoms on the left side?
Initially, it was just cramping, primarily in my left leg, especially if I went out for a jog or anything of that nature. And then it also, I began to have it in both legs. And then I began to notice these what are called fasciculations. Fasciculations are muscle twitches that you can see.
Okay.
We all have those sometimes around our eyes, little
yeah.
fasciculating eye muscles. But mine were bizarre. They started in my legs, worked their way up, and within 4 or 5 months, every muscle in my body was fasciculating.
Really?
From the bottom of my feet to the top of my head.
Even your legs and your...
Every bit. Torso.
Oh, well, constantly
scalp.
twitching?
Everything. Everything.
Over the course of a couple months?
Yeah, more like about 4 or 5 months.
Wow.
And I had started seeing a neurologist during this time. And so when you, that is one of the signs of ALS or Lou Gehrig's disease. And so my neurologist began to run the tests that are typical to try to make that diagnosis.
Oh gosh.
I had some of those symptoms. I didn't have all of them, but as time went on, I became more and more convinced that I had ALS. And finally, I think after 6 months of observation and testing, I was referred to the ALS Center in Houston.
Really?
Yes.
Because did they not know what was going on and they thought go there for further testing?
Yeah, and I think my neurologist felt like I had it. And I had enough of the symptoms, but I didn't have all of them.
So it's kind of a weird case then.
Yeah, and in my case, one of the things I learned in this, Justin, was that if you think you have the disease, it's just about as bad as having the disease.
Yeah.
I really had it in my mind that I had it, and I didn't. I had a mercury toxicity issue.
Wow.
And I had been working in dentistry for all these years, 22 years at the time. I hadn't put a mercury filling in 20 of those years. But I had been removing those fillings, and I was taking no precautions myself.
Which is very important for people to know about. If you're going to get mercury fillings removed, the dentist needs to take precaution.
I think obviously he needs to take precaution for the patient.
Okay.
But he should be taking precaution for himself and for the staff.
Right.
And for the environment, for Pete's sake. I mean, there are all sorts of things that we as dentists should be doing to just protect the environment, because what we take out of the mouth and collect, we have to put into a sealed jar and have someone with a hazmat license take that off.
It's crazy.
Isn't that amazing?
Unreal.
Now, I could put a filling in your teeth today, and that would be I would just be a blessed
You'd be
dentist.
the best thing ever. Yeah.
But if I take it out, that has to go into a sealed container, and someone with a professional hazmat license takes it off, because you can't put it in a landfill, for Pete's sake.
My goodness.
Isn't that amazing?
Yeah, it's
just so bizarre.
Yeah.
But at any rate, so that's what happened. I got sick, And as I recovered the next year, I'd made vast changes in my practice. I was not going to be re-exposed to mercury again.
Mm-hmm.
So I've been very, very careful about that. I even personally chose not to eat any more seafood. I've had one bite of fish in 16 years.
Wow.
Yeah, just because I want to avoid that exposure.
Right.
And I measured such high levels of mercury when I was sick, I can understand. I've seen patients since then who had high levels. I've never seen anybody who approached the levels I had.
What were your levels?
Well, from a hair and urine standpoint, Doctor's Data Lab, which is a huge testing lab in Chicago, said I doubled what they had seen in the past.
You
Yeah.
had doubled.
I doubled it. Yeah. So this was 16 years ago.
Wow.
And
you must have a really strong constitution because you had been removing, not putting in, but removing fillings for
Yes.
20 years.
Yes.
And man, that's amazing that it took 20 years for you to feel that.
Well, and some dentists seem to be almost immune to the effects of mercury, like some people are immune to the effects of asbestos or smoking. We all have different constitutions.
Yeah.
I was able to detoxify well because when I test now, I test myself annually, my mercury levels are as low as I ever see.
Wow.
But I've avoided exposure, and I have been very intentional about detoxing, mainly sweating. I try to sweat every day.
Mm-hmm.
And that really helps a nice, slow, gradual detox.
And you did a sauna or so.
Yes.
You still do sauna therapy?
Yeah, I did sauna therapy for several years.
Okay.
And because interestingly enough, when I had this toxicity, I lost my ability to sweat.
Oh, isn't that interesting?
That
I've
happens
heard
occasionally. It can happen, especially with heavy metals and mercury in particular.
that. Interesting.
So I was one of those.
Isn't that interesting how that works? The very thing you need to do,
Yes.
it prevents you from doing.
Mercury can shut it down because mercury it loves to interrupt enzyme systems and hormonal systems. And in my case, I lost my ability to sweat.
Interesting.
So literally, I think was somewhere around the end of the second month or in the third month, getting in the sauna every day before I finally broke a sweat.
Yeah.
Yeah. So that was great.
And you're in Texas, so it's like,
Yeah,
that should be easy.
Yeah, and so now I don't have the sauna. I don't need it anymore. I can go out now that
You
my
can just be
mercury
outside.
levels. Yeah, I'm fine. I can sweat.
Wow. So something that people should look for in a biological, or they should look first for a biological dentist who understands the connection between oral pathology and your systemic overall health, right?
I think so, sure.
A lot of people are waking up to this fact now, right?
Mm-hmm.
Yeah.
I tell people if you're looking for a holistic dentist, a great place is to look at the IAOMT website. IAOMT.org is a great website. And then if I were really serious about finding a holistic dentist, I would go interview them. And I would say, hey, I just want to know a couple of things. What sort of protection do you offer yourself and your patients when you're removing mercury fillings?
Really important.
Yeah, and they better be saying, well, I use a rubber dam, I use high volume suction, I have a mercury separator on my vacuum system so I'm not contaminating the public water supply.
Okay.
And
how does it prevent the mercury from getting into the air when those chemicals are volatilized?
Well,
is that where the vacuum comes in?
The vacuum. Well, we have an extra powerful, it looks like an elephant's snout in front of the face. It's powerful. And so in our patients, and I think it's important, the IAOMT developed a protocol called the SMART protocol.
Okay. Safe
Mercury Amalgam Removal Technique.
Okay.
Yeah.
Okay.
Many dentists have been trained in that. And if they have, and you go in there and have your mercury filling removed, it should be done in a way that you're not exposed.
Okay.
And if it's done properly, the patient will be completely draped. There will not be any part of their skin exposed.
Right.
And that tooth should be very much isolated with a rubber dam.
Okay.
And so I feel great about that technique. I think it does protect patients and dental staff.
And you guys here will do, when you replace the mercury filling with another substance, it's important to understand, or it's important for the patient to get something that's biologically compatible, right?
It is. I think that's important.
And you do that here?
We do.
Okay.
And you can determine that through a blood test.
Okay.
There's a serum test.
Mm-hmm.
And interestingly enough, since we've been doing this for 16 years ago, we didn't have that many materials that were biocompatible.
Okay.
Today, many of the dental materials are biocompatible.
And so what you'll do is have their blood interact with the material and see if there's a white blood cell production or see if there's an interaction of some kind, and then you determine which material is going to be most compatible. Is that right?
Yes, it's the blood is sent to a lab.
Okay.
And the laboratory takes the patient's serum.
Okay.
And they do basically what you see in an allergy test, where they present the serum against virtually every known dental material.
Wow.
And then they get a panel that prints out, and it shows whether your serum produced an antibody to the material.
Wow.
Yeah, it's all measured with a photochemical type cell that reads, I know I'm not languaging that properly, but it's measured, and you can see it. If they bring the slide out, you can see some of those serum samples will be very cloudy. Well, you produced an antibody to whatever that antigen was, whatever that material was in dentistry. And that's not.
So why that's important is if you get some material put in your mouth that's not biologically compatible, it's going to put an overall burden on your immune system. Correct. Is that kind of the idea?
Yeah, it'll be a constant challenge.
Okay.
To your immune system. And we don't think about it that much, but whatever gets put in your mouth is there 24/7.
All the time, right?
So there aren't many things that can present that kind of constant challenge like dentistry can.
Yeah. Yeah, 24 hours a day, 7 days a week, all the time.
That's right.
Wow, so people fly from all over the world to come here.
Well, they do.
Which is amazing.
Oh, we never would have dreamed it.
Isn't that amazing?
Yes.
So humbling. And from Australia, I've heard, and different countries, people flying in, and it's so great.
It's not what we expected, but we're grateful that we get to, and I'm so grateful. It's interesting that you had me tell my story, because I've told it so many times it's not quite as emotional as it used to be, but I still say it still elevates my emotions, because it was such a hard time for my wife and me. It's sad, and then to realize now, and retrospectively, that it was one of the greatest blessings in my life, actually.
Because you couldn't have kept going that way.
Well, I couldn't have kept going, and I wouldn't have had the opportunity to meet all the incredible patients that I have met, or to empathize with their long list of health
symptoms,
issues that people get sent here with.
And knowing what you're doing now, helping people, is got to feel really good, because knowing, like, if you knew what you know now and you're putting in if you're putting in mercury fillings, you're going to have a disconnect in your head, and you're going to go to bed at night thinking, I didn't do this patient right. And so now knowing that you're actually helping people systemically, it must be such a...
that's a blessing.
Yeah.
It's a blessing.
Yeah.
Now, I practiced cosmetic dentistry for 22 years.
Wow.
I still want things to be cosmetic.
Right.
Fortunately, we do have materials that are beautiful, that are, for the most part, are biocompatible. But the joy of doing this type of dentistry, where you're really helping an entire person, mind, body, and soul, that's so much more, in my opinion, so much more gratifying than putting the set of veneers on.
Yeah, something superficial.
Yeah.
What is the weirdest, strangest case you've had where a symptom or some bizarre thing going on with someone has been affected by getting their work done here? Have you seen? I'm sure you've had some pretty crazy stories.
The most bizarre. I just recorded this young lady, and I still am a bit hesitant to say it was just dentistry, because it's so bizarre. But this was a young lady that was in a fetal position, and her mother rolled her in a wheelchair, and she could only communicate by barely moving one finger or her eyes.
Wow.
Totally nonverbal, just drooling. And the mother had taken this young girl, I think she was 17 at the time, all over the country, looking for a solution. No one could identify the issue. She finally said, well, maybe it was her teeth. She had her wisdom teeth removed.
Oh my goodness.
The mother brought her. I even had some issues about whether I was going to sedate this girl or not because of her health issues, but we did. And we cleaned out 2 lower cavitations on this girl. And I really told the mom, I don't know whether this is going to have any benefit whatsoever. She did have some what's called osteonecrosis, where she'd had her wisdom teeth removed. But that's all we did. We did that. And about a few weeks later, she walked down the hall with a walker.
Oh my gosh.
Yeah, it's unbelievable.
Wow.
And I had not seen this beautiful young lady for about 10 years. She moved to another state.
Oh my goodness.
She called me when she returned to Texas just recently. I've been thinking about her. She called me, and I interviewed her, and she's the most beautiful mother of a 9 or 10-year-old child, and you would never dream that she ever had an issue. She said everything completely resolved after that procedure. And so that's the most dramatic. Now, we've seen everything in between.
Yeah,
and we've
a lot
seen
of weird cases.
and we've seen a lot of things that didn't resolve, too.
Right.
Dentistry is not always the issue, but it is a part of the puzzle most times.
It plays or puts such a tremendous burden on the immune system, right? That sometimes all of the resources of the immune system can't work on other infections that you might have because of the burden there.
Yeah.
So that could be an issue.
I think that's correct. I think that's absolutely telling the truth.
Well, Doc, thanks for sharing your story, and thanks for being on our podcast multiple times.
Thank you.
And you're amazing. And this practice, so you're extending this practice, and in late or maybe by February of 2019, this whole separate wing should be open, right?
There will be.
That's so fun.
Yeah.
That's so fun.
Thank you.
Hey, thanks for watching the video. I hope you really enjoyed it. Make sure to click over here and subscribe to our show so you don't miss any of the live radio shows that we do every week. And make sure also to watch these videos here. I think you're really going to like them. Leave a comment below. Let me know what you think. And if you want to take your health to the next level, join the Extreme Health Academy in the description below.